By Nilesh Vora, MD. March is Colorectal Awareness Month, but there is one thing that makes this year different from previous Colorectal Cancer Awareness Months: COVID-19. I've served our community as an oncologist for nearly 2 decades, and while I've always firmly believed in colonoscopy screenings for colon cancer, this year it's more important than ever. With the safer at home orders, the vulnerable senior population has been relegated to the confines of their own homes, encouraged to only leave for essentials. This means many seniors are delaying their care in the hopes that when the coronavirus pandemic subsides, they can go back to their normal activities. I'm here to implore you, if you are due for a colonoscopy, don't delay your care. The New England Journal of Medicine published a 2013 article that followed 902 healthcare professionals for 22 years. Those who received colonoscopies had a 68% lower mortality rate from colon cancer than others in the group. Putting it off for even 1 or 2 years may not seem like a big deal, but it could mean the difference between a stage 1 diagnosis, easiest to treat and recover, and a stage 3 diagnosis, harder to treat, slower recovery. Adults who are 50 years of age or older also see a significant rise in the occurrence of colon cancer, making it something that shouldn't be ignored or avoided. The American Cancer Society reports that colon cancer is the second leading cause of death in men and women in the U.S., and 90% of those are older than 50. From the time the first abnormal cells start to grow into polyps, it usually takes about 10 to 15 years for them to develop into colorectal cancer. With regular screenings, however, most polyps can be found and removed before they have the chance to turn into cancer. Another misconception that should be dispelled is that older adults should stop being screened past a certain age. Colorectal screenings should occur every 10 years at least, and could be more often if a senior has developed polyps. Regular colonoscopies shouldn't stop, even as seniors approach their 70s or even 80s. Seniors are just as likely to survive colon cancer as someone in their 50s. There shouldn't be a one-and-done philosophy when it comes to screening. While colonoscopies are considered the gold standard, there are a few other screening options that are perceived to be more comfortable. I warn all my patients, however, that should one of these other screenings find an abnormality, you will most likely have to do a colonoscopy anyway to rule out cancerous polyps. One of those more comfortable options is a sigmoidoscopy, a less invasive procedure that examines the lower portion of the colon and can remove polyps in tissue. It should be conducted every 5 years. The other is the completely non-invasive Fecal Occult Blood Test, which can identify traces of blood in the stool and can be done in the comfort of your own home.